which cup should I transition my baby onto after they're done with bottles and I want to start introducing water? This is a common question that parents ask me, and it's so confusing because there's so much misinformation and advice out there. No one really knows what they should be doing. So today I'm going to give you the lowdown on the different types of cups, the pros and cons for each one to help you decide which is the best for your child. So you can actually start off feeding your baby sips of water when they're around 6 months of age, and you start them on solids. So which cup are we going to use? Well, we'll go through the different types. So the first option is a sippy cup. Lots of parents like this and a lot of kids like them as well. The pros are that they are non-messy, so they're spill proof, so if they topple over, it's not going to get liquid everywhere, it's not going to leak in your bag. However, there are a few disadvantages. It can affect the maturation or them developing their oral motor skills, and it also delays them being able to have that mature suck and swallow that they need when they're a little bit older. It can also impact speech if they're using it a lot because it affects the placement of the tongue, and it can also increase tooth decay. So if you're just using water in here, it's not a problem, but I do know that a lot of parents do put other liquids into the beakers, squash, a little bit of orange juice, milk. And because you're increasing the time that the liquid is in contact with the teeth, it actually can increase tooth decay. So those are the disadvantages of using a sippy cup, and we really don't recommend them as paediatricians. So our second option is a straw cup. Again, very, very common with parents. A lot of them come with lids, which makes spillages a lot less likely. So the advantages are less spillages, and it's also good at teaching them to pull the tongue to the back of the mouth, which is an important skill. The cons of having a straw cup is that it's not easy and it doesn't teach them that skill of tipping and being able to drink from an open cup that they'll need to be able to do later. And also it can be quite easy to get infections. There's so many different components to this. You've got the straw, you've got the valve, and if you don't take them out and clean them, especially in a hot country like Singapore, then you can get mold on there, which will increase their risk of infections. So that's something that you need to think about as well. A third option is a beaker, which does not have a valve, so it doesn't stop water from spilling out. However, it does control them being able to drink a little bit, and it's less mess than an open cup. So the advantages are it's not as messy, but it can still cause some mess. If it topples over, the water will just come out. But it's easier for kids to coordinate, and it does teach them the important skills of being able to suck and swallow, and it's much easier for them to transition to an open cup later on. Another option are the 360 cups that are the non-spillable cups. The advantages are they don't spill, so no mess. The disadvantages are that they're actually quite difficult for babies and young children to use. You really have to tip it a lot to be able to get the liquid out, and it doesn't make it that easy for them to transition to a normal cup later on. The final option and the best option is the open cup, and this is what we recommend. The advantages to the open cup is that it teaches them the important skill of being able to get a seal around the top and being able to tip back and drink and develop those important oral motor skills that they need. It also promotes independence. They copy you, they see you drinking from a cup and they want to drink from a cup as well. The disadvantages is that it's very messy. It can get everywhere. If it's just water in there, it's not so much of an issue, but if you are putting anything else in there, then there will be mess everywhere. But kids are messy, that's part of life. I hope this video has helped you. I've gone through all of the options. It's up to you to decide which is the best one for you. As paediatricians, we do recommend the open cups, but for those few months in between whilst they're still quite young, then the straw cup is a good alternative as well. But just make sure that you are cleaning all of the components properly. I'll see you next time. Bye.